So hello, everyone. Welcome to our next product training session. My name is Martin, and I would like to welcome everyone joining me live on Zoom and on Facebook. So the title of the webinar today is Strong Heart, Long Life. During the webinar, I'm going to focus on two Nutricode supplements, cholesterol and hemoglobin. But there will be more than that. I will also show you how an imbalance of those two components can significantly affect the body, especially the heart. The heart is the muscle located at the center of our circulation system. It pumps blood around your body as it beats. This blood sends oxygen and nutrients to all parts of your body and also carries away unwanted carbon dioxide and waste products. Both hemoglobin and cholesterol have got impact on the heart and cardiovascular system. Living in a very fast-paced world often means that we tend to forget about health and we neglect it. Certain health issues, such as having high cholesterol, may not have symptoms. It is a hidden risk factor, which means it happens without us knowing until it's too late. Others, such as anemia, do have symptoms which can impact a person's everyday life. Having high cholesterol and low hemoglobin levels can be very hard for our heart. If you want to broaden your knowledge on this subject and discover how Nutricode supplements cholesterol and hemoglobin can help support your health, then stay with me until the end of the session. So here is a short training objective. After the training session, you will know what cholesterol and hemoglobin are and what are their functions. You'll also be able to explain how high cholesterol and low hemoglobin can impact the body and how to naturally support healthy levels of both. You will be able to introduce Nutricode Daily Care Cholesterol and Hemoglobin to your customers and professionally explain the benefits of these supplements, which I think is quite essential. Also, you should be able to identify your potential customers as well as determine who should take special precautions before taking those supplements and why. And finally, in addition, you will gain some knowledge about the red blood cells, causes and types of anemia. You'll find out which Nutricode supplements cannot be taken together with Daily Care, cholesterol, and hemoglobin as well. So before we start, some advisory information. So please note that food supplements must not be used as substitute for a varied and balanced diet and a healthy lifestyle. If you are pregnant, breastfeeding, or taking any medication or under medical supervision, please consult a doctor or healthcare professional before use. And also, the purpose of this training is strictly educational. Well, so the first supplement that I would like to talk about is cholesterol. But first of all, before we start, let's determine what cholesterol is. Cholesterol is a fatty substance found in your blood. It's produced naturally in the liver. Everyone has got cholesterol. We need it to stay healthy because every single cell in our body needs cholesterol to function properly. So it's a very, very important substance. For example, in ovaries and testicles, cholesterol is used to produce steroid hormones such as estrogen and testosterone. So without cholesterol, we won't be able to produce those hormones sufficiently. Also, a form of cholesterol is in the skin. In the skin is changed to vitamin D when you expose your skin to sunlight. Liver cells use cholesterol for synthesis of bile, which breaks down fats when you eat food rich in different kinds of fats. So it's important for for digestion. Bile is important for digestion. And without cholesterol, it cannot be really produced. It's very important to note that the liver, as I said, synthesizes cholesterol, but in addition to the cholesterol we eat in food, only animal foods such as beef, pork, milk products, eggs contain cholesterol. Plants do not contain cholesterol, basically. Vegetarians do not have cholesterol in their diet for that reason and depend upon synthesis by the liver. So the term high cholesterol is widely used, and we've heard, we've all heard about that. So what does that mean? High cholesterol is when you have too much cholesterol in your blood. Having high cholesterol can increase your risk of heart attack and different other circulatory diseases. So to understand high cholesterol, we need to get to know the types of cholesterol first. There are two main types of cholesterol, one good and the other one is bad. Having too much bad cholesterol can cause problems with your health. Cholesterol is carried in your blood by proteins. When cholesterol and proteins combine, then they are called lipoproteins. High-density lipoproteins, or HDL, is called good cholesterol. This is because it gets rid of the bad cholesterol from your blood. It takes cholesterol that you don't need back to the liver. The liver then breaks it down so it can be passed out of your body. Low-density lipoproteins, or LDL, is called bad cholesterol. And this is because when there's too much of it, it can build up inside your walls of the blood vessels. This clogs them up, causing narrowing of the arteries, which increases your risk of having a heart attack or stroke. High cholesterol is the main cause of atherosclerosis. Atherosclerosis is thickening or hardening of the arteries caused by a buildup of plaque in the inner lining of an artery. Risk factors other than high cholesterol or high triglycerides, for example, may also include high blood pressure, smoking, diabetes, obesity, and also eating saturated fats. So what causes high cholesterol? So we know we all have it. We know that there are two different types of cholesterol. We know that the bad one, the LDL, is the problem. So what causes high cholesterol? Anyone can get high cholesterol, and it can be caused by many different things. Some things you can control, like, for example, your lifestyle habits. Others, unfortunately, you can't. As long as you take care of the things that you can control, it will help lower your risk. So let's take a look at the things that cause high cholesterol and you can control. Those things include, for instance, eating too much saturated fat. And saturated fat can be found in beef, lamb, pork, poultry, so generally speaking, meat. But also you can find saturated fat in lard, cream, especially double cream because it's quite fatty, butter and cheese. So when you eat too much of those products, you may be later on in life at risk of having high cholesterol. Another factor that may cause high cholesterol, which you can control, is not being active enough. So physical activity is so important in order to keep your cholesterol level at the right, at bay, let's say. Because if you are not active, then you are more likely to put on weight. So there will be deposition of a fat tissue, and that will be one of the risk factors of having high cholesterol. Also having too much body fat, so that's the next step, especially around your waist. And why is that? The fat which is around your waist is called visceral fat. Substances released by visceral fat, including free fatty acids, enter the portal vein and then travel to your liver, where they can be influenced by the liver, by basically the production of blood lipids. So visceral fat, the fat which is around your waist, is directly linked to a higher level of the bad cholesterol, but also it lowers the good cholesterol. And unfortunately, people who's got accumulation of fat around the waist, they're at risk of becoming insulin resistant. In a second, I'm going to tell you what it is. But now, I just want to point out that also smoking can lead to high cholesterol levels too. And if you are overweight or you have diabetes, you are at much greater risk of having high cholesterol. So there are certain things that you can't control, but they may cause high cholesterol. And the first thing is getting older. Cholesterol levels generally increase with age, unfortunately. So for men, being older than 45 is a risk factor for raised cholesterol, while if you're a woman, then the age is 55, so a little bit higher. This means that older people tend to be at greater risk of developing heart diseases as well. Another factor which you can't control is ethnic background. Ethnic background, for example, people of South Asian origin tend to have more harmful types of LDL cholesterol and less helpful type of HDL cholesterol compared to people, for example, who live in Europe. South Asian people may also have worse ratio of LDL to HDL cholesterol, which aren't explained by differences in diet. And the last factor is an underactive thyroid gland. Hypothyroidism is a secondary cause of high cholesterol levels. The effect of this condition on lipid metabolism occurs through several different mechanisms due to low T4 and T3. These are hormones produced by the thyroid, and also due to the elevation of TSH directly. And the TSH is the thyroid hormone as well. It's a thyroid stimulating hormone. So if you suffer from underactive thyroid, your liver is not able to remove the bad cholesterol from the blood in an effective way. So therefore, you may have increased LDL, the bad cholesterol in your blood. Secondly, there is an increased risk of absorption of cholesterol in the intestine, which leads to an increased levels of triglycerides in your blood. So elevated TSH increases basically production of cholesterol by the liver. So there are many factors that can increase level of LDL in the blood among people who suffer from this condition, from underactive thyroid. So the next step is to find out about the symptoms. So what are the symptoms of high cholesterol? There usually, basically, there aren't any usual typical symptoms that you may have if you have high cholesterol, which is why it's so important to get it checked on the regular basis. As I said, it's a hidden factor, which means it happens without us knowing until it's too late. So how can you lower your cholesterol in a natural way? Or how can you keep your cholesterol at the right level? So first of all is diet. Diet is so important. So eating healthy food, having well-balanced diet, low in saturated fats, it's key number one. Also, in here, I would like you to encourage you to join our Fit6 program. The Fit6 program is an excellent dietary program that will also help you keep your cholesterol at the right level. The next point is to be active. So physical activity also helps to lower your risk of having high cholesterol. If you smoke, then quit smoking. And finally, take Nutricode Daily Care Cholesterol. So let me tell you now briefly about this supplement. The Nutricode Daily Care Cholesterol contains a composition of active substances that help to maintain the correct level of cholesterol in the blood. It contains important amino acids, plant extracts, and vitamins, which are recommended in case of lipid disorders and increased blood sugar levels as well. So it's not only about the cholesterol, but also it's about controlling the other physiological processes that are happening in our body and which are directly related to cholesterol levels. So let's take a look what the supplement contains. So it contains manacolin K. Manacolin K is an active compound naturally present in red yeast rice, which is chemically identical to cholesterol statin drugs. It helps maintain normal blood cholesterol levels and triglycerides levels. Our blood also contains a type of fat cells called triglycerides. So it's not only the cholesterol. This is stored in the body's fat cells. If someone is overweight, if someone is eating quite a lot of fatty food, food which is full of sugar, or drinking too much alcohol, all of these factors may increase the triglycerides level in the blood. Triglycerides can also contribute to the narrowing of the artery walls and also increase your risk of cardiovascular diseases. So it's very important to know that it's not only the cholesterol, but also we need to pay attention to triglycerides. So once again, manacolin K helps maintain normal blood cholesterol levels, but also triglycerides levels. The next compound, which you can find in this supplement, is turmeric extract and chokeberry extract. Both support liver function. So if your liver is unhealthy or is poorly functioning, the production of bile may be reduced, which can result in increased cholesterol levels. So supporting your liver function is crucial for metabolism of cholesterol. Next, there is L-arginine. L-arginine is an amino acid that helps the body build proteins. It helps to reduce body weight and blood pressure. Our body converts L-arginine into a powerful neurotransmitter that helps blood vessels relax, and this way it helps to improve blood flow. The next compound or ingredient of the supplement is inositol. Inositol may aid blood sugar control by improving insulin sensitivity. There's one study that I found which confirmed that inositol improved insulin sensitivity, blood pressure, and also cholesterol levels among everyone who participated in the trial. So it is a scientifically proven ingredient. Having poor blood sugar control can make cholesterol levels worse. If you have diabetes and have low levels of good cholesterol, but high levels of bad cholesterol, and also high triglycerides, you have a condition called diabetic dyslipidemia. Up to 70% of people with type 2 diabetes have this condition. So keeping your blood sugar under control by improving insulin sensitivity will help to keep levels of cholesterol in your blood intact. Okay, so let's move on to the next one. The next ingredient which you can find in this supplement is alpha lipoic acid. Alpha lipoic acid has been shown to reduce insulin resistance, improve blood sugar control, but also ease symptoms of nerve damage and lower the risk of diabetic retinopathy. Retinopathy is a condition caused by high sugar levels. It affects the back of the eye, the retina, and it can cause blindness if it's not treated. So, as I said, let me tell you about insulin resistance. So what is it? Insulin resistance is when cells in your muscles, fat, and liver don't respond well to insulin and can't easily take up glucose from your blood. As a result, your pancreas makes more insulin to help glucose enter your cells. As you know, glucose is very important for our cells because it's a main component that will help the cell to produce energy. So glucose is important to us, but it cannot stay inside the bloodstream. It can be taken up by the cells, but it's dangerous if high glucose level is inside your bloodstream. So basically, scientists believe that alpha lipoic acid helps lower blood sugar by promoting processes that can remove fat that has accumulated in muscle cells, which otherwise makes insulin less effective. This supplement also contains coenzyme Q10. Coenzyme Q10 is a compound that acts as an antioxidant, but also helps generate energy in your cells. This ingredient, coenzyme Q10, also functions as a natural aid in lowering cholesterol and improving heart health. And finally, you can find in this supplement vitamin B12 and folic acid. Both help maintain normal metabolism of homocysteine. Homocysteine is a type of amino acid, a chemical your body produces and also uses to make proteins. You get homocysteine also from eating meat. High level of homocysteine may mean that you may have vitamin deficiency. Elevated homocysteine increases your risk of dementia, heart disease, and stroke. And vitamin B12 and folic acid help to maintain the normal healthy levels of homocysteine. If you want to check the level of homocysteine in your blood, you should go to your GP and ask for a blood test. So another step is special precautions. That certain group of people that, in my opinion, and also according to some scientific studies, should take certain precautions while taking the supplement, and this is due to the strong and very powerful ingredients the supplement contains. So, for example, the red yeast rice extract contains monacolin K, the key active compound that is used to make statin drugs as well. And statin drugs are prescribed by doctors in order to lower cholesterol. For this reason, people shouldn't take supplements that contain red yeast rice if they're already taking statins, unless obviously directed differently by a healthcare professional. But I would definitely recommend a consultation. So red yeast rice may also interact with the same drugs that statins interact with, including other cholesterol-lowering drugs, antibiotics, certain antidepressants, antifungals, and antiviral medications. So if you or your customers are taking any medications, it's a good idea to speak with a healthcare professional before start taking this supplement. Also, pregnancy. Pregnant ladies should take precautions. So red yeast rice is likely unsafe when taken by mouth during pregnancy. So this supplement should be avoided by pregnant ladies. Also, certain precautions should take people who's got liver problems. Red list rice contains a chemical that is the same as in statins, as I said, and it is metabolized by the liver, and therefore it should be used cautiously or avoided by people with liver problems. This Nutricode supplement, the Daily Care Cholesterol, also shouldn't be taken together with our Vitality Boost, hair, skin and nails, and also Vit Complete. So who is this supplement for then? This supplement is great for people who would like to maintain the correct level of fats in their blood, such as cholesterol and triglycerides. It's also good for people who would like to reduce the risk of metabolic syndrome. It's great for people who would like to decrease inflammation in the body. So your potential customers can be people who consume a lot of meat and dairy products, because consuming a lot of these products will increase your risk of having high cholesterol. It's good for people who are not active enough, because they're more likely to have more body fat, especially around the waist. And as I explained during the training session today, that will increase your risk of having high cholesterol. It's great for people who consume a lot of saturated fats. Saturated fat is found in bacon, sausages, cakes, biscuits, butter, cheese, ice cream, and chocolate. So people who consume excessively those types of foods, they are very likely to have high cholesterol level. So let's move on to the next supplement and to the next topic, hemoglobin. So before I'll tell you about the supplement, let's focus on hemoglobin. Hemoglobin is a substance in red blood cells that makes it possible for blood to transport oxygen throughout the body. Hemoglobin is what gives blood the color, red color. So what are normal hemoglobin levels? For men, it's between 14 to 17.5 grams per deciliter, and for ladies, it's between 12.3 to 15.3. Low or high hemoglobin concentrations are associated with higher risk of developing cardiovascular disease and also higher all-cause mortality, according to some scientific research. Researching and actually reaching and maintaining hemoglobin concentrations within the normal range means, of course, better cardiovascular health, but also decreased all-cause of mortality. So if a disease or a condition, for example, lack of vitamins, minerals such as iron or vitamin B12, affect the body's production of red blood cells, the hemoglobin levels may drop. Fewer red blood cells and lower hemoglobin levels may cause a person to develop anemia. So what is anemia? Anemia is a blood disorder that occurs when there's not enough hemoglobin in person's blood. There are several different types of anemia. Some types cause only mild health problems, while others are more severe. Each type of anemia comes from one of the following factors. First, for example, the body cannot make enough hemoglobin, or the body makes hemoglobin, but the hemoglobin doesn't work right, or the body does not make hemoglobin because it doesn't make enough red blood cells, or the body breaks down red blood cells too fast. So when left untreated, anemia takes a toll on the body, particularly the heart. Because anemia can often mean there is less oxygen being carried by the blood cells and delivered to your body, anemia can result in a decrease in oxygen supply to the heart that can contribute to coronary diseases and also risk of heart attacks. The body's response to anemia may also result in increased thickness of the heart muscle or even enlargement of the heart muscle over time, and that can ultimately lead to the development of heart failure. So what causes anemia? Although many parts of the body help make red blood cells, most of the work is done by the bone marrow. Bone marrow is the soft tissue in the center of bones that helps form all blood cells, not only the red blood cells. Healthy red blood cells last between 90 to 120 days. Parts of your body then remove old blood cells. There's a hormone called erythropoietin. It's made by your kidneys, and it signals your bone marrow to make more red blood cells. The body needs certain vitamins, however, minerals and nutrients to make enough red blood cells. Iron, vitamin B12, and folic acid are three of the most important ones. The body may not have enough of these nutrients due to certain factors. So, for example, number one, changes in the lining of the stomach or intestines that affect how well nutrients are absorbed. So, for example, if someone is suffering from a disease like celiac disease, they may have a problem absorbing those nutrients from food. Also, poor diet. So if your diet is not rich in products that contain iron, vitamin B12, or folic acid, also you may be deficient. And also surgery that removes part of the stomach or intestines may impair absorption of those nutrients. So what are the possible causes of anemia? There are few different causes. For example, there's anemia, which is iron deficiency, vitamin B12 deficiency, and also folate deficiency. There are other causes of anemia, but we are not going to focus on them because they require medical intervention. So here we're talking about how to prevent anemia or treat anemia, which is a result of nutrient deficiencies. So who is more likely to develop iron deficiency anemia? First of all, anyone can develop iron deficiency anemia, although the following groups have a higher risk. So the first one is women because of blood loss during monthly periods and, for example, childbirth. Secondly, people over 65 who are more likely to have diets that are low in iron. Also, people who are on blood thinners such as aspirin and heparin. If you take aspirin, for example, for headaches, you may become iron deficient if that happens for a long time. Another group, people who have kidney failure, if their kidneys are not functioning properly, and also people who have trouble absorbing iron for the reasons I've just stated a few minutes ago. The next one is vitamin B12 deficiency anemia. So who is more likely to develop this type of anemia? So first of all, vegans who consume no animal products and vegetarians who consume some animal products, for example, dairy products, eggs, or both, but not meat. They have a higher risk of developing vitamin B12 deficiency anemia because natural food sources of vitamin B12 are limited to animal foods, unfortunately. Also, people who are 65 or older, and one of the causes is that when we get older, the production of intrinsic factor and hydrochloric acid in the stomach decrease, and thus vitamin B12 absorption decreases as well. Another condition associated with B12 deficiency is in older people is Helicobacter pylori. infection. This infection or this bacterium causes inflammation that leads to malabsorption of vitamin B12 from food. And just today, I read a scientific study that confirmed that perhaps about 50% of the world population is infected with Helicobacter pylori, but we simply don't know about that. There is a certain test that everyone can do. So if you would like to check whether you have this bacterium or not, I recommend you to go to your GP and ask for a special test. Okay, so yes, and the next group of people will be people who had a surgery, people who have gastrointestinal surgery, such as a gastric bypass for a weight loss. They also may have difficulty absorbing vitamin B12, and the risk of having anemia is higher. And finally, the folate deficiency anemia. So who is mostly at risk? First of all, people who drink a lot of alcohol, people who are 60 years old or older for the reasons that I've stated earlier, people whose diet lacks folate, and folate you can find in leafy vegetables, citrus fruits, beans, and whole grains. Also pregnancy and breastfeeding ladies, they may be at risk. And this is because the developing baby needs more folic acid. Also, the mother absorbs it more slowly. A lack of folate during pregnancy is linked to major birth defects that affect the brain, spinal cord, and the spine of the baby. So it's called neural tube defects. Also, people who take certain medications, for example, those ones for epilepsy, and people who suffer from certain diseases of the lower digestive tract, such as mentioned celiac disease or irritable bowel syndrome, for instance. So now, what is it? The Nutricode Daily Care Hemoglobin is a food supplement which contains an active composition of micro-ingredients in the best bioavailable form. Bioavailability, it means absorption of those ingredients. So let's take a look what the supplement contains. So the first few ingredients, it's nettle extract, fenugreek, riboflavin, and methionine. All of these promote proper red blood cell production. Then we've got copper and manganese. Those two minerals improve red blood cell transportation, which is very important too. Then you can find in the supplement chokeberry extract, which improves circulation. Then there's dog rose herbal extract, which strengthens your blood vessels and provides vitamin C to increase iron absorption, because vitamin C is also very important for iron absorption. This supplement also contains beetroot extract and spirulina, which support the body in case of anemia, because those two ingredients are very nutritious. You can find in there organic iron, which supports regeneration of red blood cells. And finally, and obviously, folic acid, vitamin B2, B6, and B12 that are essential for hemoglobin synthesis, but the compounds also break down homocysteine to create other chemicals your body needs. So who is this supplement for? This supplement is great for people who would like to support the correct level of hemoglobin in their blood. It's good for people who would like to improve their blood circulation. It's good for people who would like to strengthen their blood vessels, and also for people who need a supplement that will help with metabolism of homocysteine. So those ones who eat quite a lot of meat. And finally, it's good for people who need a supplement to support the increase of low hemoglobin. So who may be your potential customers? So definitely women in the first place because of blood loss during monthly periods. People 65 or older who are more likely to have diets that are low in iron. People who are on blood thinners such as aspirin and heparin. People who feel tired, cold, and experience weakness caused by hemoglobin deficiency. Your potential customers may be people who lack iron in their diets, which makes it harder for the bone marrow to produce hemoglobin. And finally, people who lack folate or vitamin B12 in their diet, such as vegetarians or vegans. And as we know, lack of vitamin B12 can lead to the body producing fewer red blood cells than needed. And also the Nutricode Daily Care Hemoglobin shouldn't be taken together with our Inner Balance, Vitality Boost, and also hair, skin, and nails. So as usually, at the end of the training, there is a special code for you. So you can share it with your team members. You will get 25% off on Daily Care Cholesterol and Hemoglobin. This promo code is Healthy Heart. Healthy Heart. It's valid only on the 9th of March, today, from 1 p.m. until 5 p.m. So thank you very much for joining me during the training sessions. I hope now you've got bigger knowledge and you'll feel more confident to promote those products. So have a good day, and I'll see you soon during the next webinar.